crack on.
So, if we've got a little bit of callus here, which is the sort of thing that we usually get around the edge of the heel, we very often will give our patients one of these and tell them to do it. Couple of mistakes that patients will often make with this. The first is that they will often try and do it when the skin's wet. And of course, if the skin's wet, if you imagine it's a piece of wood and you've got a bit of sandpaper like a skirting board, if you wet your sandpaper before you sand your skirting board, sorry, I can hold your foot. Then it'll just bung up, won't it? So you do this when the skin's dry. The second mistake that people will make is they will do it like that. That's how you will see somebody doing it, like they're sawing a log. Now you will get some off there, but if you think about it, what you're doing is that to the skin. So at best you'll bruise the underlying area, but remember what we said about how trauma causes the inflammatory cytokines. The body might well interpret that as trauma. So you don't want to do that. What you want to do is nice light pressure, finger and thumb. You can see you've actually got more coming off of there than there was that way. So yeah.
Less pressure on faster.
Light fast pressure on dry skin, not heavy pressure on and again, if you're pushing harder than you can do it with just a few fingers, you're doing it wrong. The other nice thing about this when they're doing it is that, of course, if you go a bit too far, it's very hard to actually do any harm when you're doing it this lightly. You could do that on healthy skin and it's not going to actually hurt. Whereas if I won't, but if I were to push and sort of saw at it there, I would get it off. So light pressure, fast movement, little and often, so you just take the top layer off without traumatising the skin underneath.
Oh, that's interesting.
Make sense?
Light and fast.
Light and fast. That's how they like it.